Hi friends, I'm at the end of a really long clinic day and I just wanted to tell you that today I met somebody who has reflux that you might find very relatable. This person has been symptomatic for over 5 years, has had endoscopies before, is taking high doses of 2 different medications, one in the morning, one at night, and still takes Tums 3 to 5 times a day just to get through the day, just to get a little bit of food down. She also can't sleep at night. She just doesn't sleep. She doesn't sleep because she can't lay down. She can't lay down because if she does, the food and fluid just passively comes right up. It just comes right like a fountain. It just comes up. It's like when you lay a half empty 2 liter bottle of soda down on its side, and it just makes a wave of soda that just drips up towards the cap, the top of the bottle. That's what happens when she lays down. So she doesn't lay down. She doesn't lay down. She can't sleep. Okay, she does sleep, but you know when she sleeps? She sleeps when it's like 3 in the morning and she's so exhausted she can't help it, and she nods off for a little while until she starts to sink back down in bed a little involuntarily and get reflux again. And then she wakes up. She literally doesn't sleep. She's nervous naturally about what treatment could include. I told her, sure, this is what it is. I explained it. I said, you know, if you want to think about it, go home and call us. You can sleep on it, I said. She started laughing because she doesn't sleep. How's she gonna sleep on it if she doesn't sleep? And what that really means is, how is she gonna let her, when we say sleep on it, it means like let our unconscious mind, you know, sort of mull over what's been coming in and help us analyze our life. She can't do it, which means she can't live. She can't live. She doesn't live. If you can't live, what is anything? If you can't sleep and you can't eat and you can't live. So the next time someone tells you that heartburn is not a big deal and it doesn't matter and you don't need to do anything about it, if someone tries to convince you that uncontrolled reflux disease is not a whole body, whole system problem, have them watch this reel, okay? Hi friends, Dr. Tejal Pandya. I am here at the end of a long clinic day. I'm tired, my hair is crazy, but I had to tell you what I discovered when I saw my post-op patients today. So I had multiple people come back after their anti-reflux surgery. They're at various stages in the post-op process. And one story in particular, I wanted to make sure I give you the follow-up because I have mentioned to you this patient before. It is a lady. If you look back through my Instagram grid, you'll see a couple of weeks ago, this lady had come in and I talked to you about someone who was having Barrett's esophagus, having terrible reflux symptoms, and she fit perfectly into what I have boiled down into the heartburn trifecta. Can't eat, can't sleep, can't live life. She fit that perfectly. And if you remember, I described to you about how when people have really poor anti-reflux barrier that's completely busted, all elements, the person can lay down. Remember I talked about the 2 liter bottle. If you lay a 2 liter bottle down, that soda just rolls up and down however it wants, right? There's nothing holding it back from flowing up and down in the bottle. And the same thing was happening inside her body and honestly in the bodies of many of you who are watching probably. Now this person was extremely nervous about having surgery and about what all her options were, and ultimately decided to go ahead. I saw her back for the first time. Let me tell you, This is the first time I have ever seen this patient look relaxed. I walked in, mind you, she had an operation only like 2 weeks ago. She comes into the office, I open the door. She had a smile on her face. She was relaxed. She was chilling. I have never seen this poor lady anything other than anxiety, worry, tension. You know the posture, the I don't even know, I'm hunching forward out of worry posture. And she had been like that for ages. Now, this person is also a caretaker, and she's not able to rest at night. It was a mess. She looked so good. She was so happy, so chill. The first thing she said when I asked how she was doing is, well, I can lay down and sleep through the night. Fantastic. That is so fantastic. I love that so much. Heartburn? No more. Big smile. She could not contain her smile. I was so happy to see how happy she was, because that is exactly what we're trying to do with anti-reflux surgery. That's exactly what we're trying to accomplish. Now she can sleep. She will be able to rest and recuperate. She will be able to enjoy life more. She will be able to eat without worry and pain and difficulty. And now we have extremely robust acid exposure control, which is going to help her begin to heal her Barrett's esophagus. What more could you ask for from a 2-hour operation, and you get to go home the same day? I don't know. I see a lot of people really worried that they're going to hate their decision to get anti-reflux surgery. Talk to her. She's going to become a poster child, right? And many of my patients feel that way. It really surprises me that so many people are worried that they're going to have a bad outcome, they're going to regret it, it's not going to work. I don't honestly really understand fully what people mean when they're posting questions online asking, well, what if the surgery doesn't work? I don't understand. That means that there's something about the way the surgery was done. I have never seen someone who had all the testing, had all the testing done, was living like that before, had surgery and regretted it, or who had immediate problems. No, that's not the majority experience. But if you go on online chat groups and you go on Facebook groups where people are sharing information, sharing experiences, and also sharing stories that they've been told, repeating bad experiences, repeating horror stories that they've been told that keep getting passed down and passed around. But remember that those are not everyone's experience, and those are not even stories that same person might have experienced. They just might be repeating things someone else told them. And I just want you to know that's not the majority experience, especially not when you go to someone that specializes in heartburn care and reflux disease and reflux surgery. The majority experience is more like this lady I saw today. And she is so happy. And that makes me so happy. So, happy Friday, story time for you, and see you next time.